And it was a question of the closing of the hospital. We had stalls up in Lewisham, and people came along and said, why are they closing the hospital? This is something that seemed completely irrational to them. And in human terms, it was completely irrational. And everyone in Lewisham, almost everyone in Lewisham, either gave birth in Lewisham, or was born in Lewisham, or knows someone who had an operation in Lewisham, or someone who was saved by the A&E. So it felt to be a vital aspect of the community. And I think what they don't recognize is that the transnational corporations that are behind TTIP look at the world in a very different way. When they look at a hospital, they don't look at it and say, this is where people are taken care of, and look at it in anything like human terms. They looked at Lewisham Hospital and they said, this has assets. And they looked at Charing Cross Hospital and they said, this has assets. And all the other hospitals that have assets, they say, we can take these over, we can sell off what is convenient to developers, and for the rest, we can have a service that is publicized very well. I mean, one thing that they do have is very good PR departments, but a service that is inferior for the patients, that is inferior for the staff, and that costs the government ultimately more. They look at the NHS and they say, here's more than $100 billion a year going into the NHS. It could go into these companies' pockets. So the vampire companies put in for a contractor. And if you look at the provisions of TTIP, there's something where it says any qualified provider. This is actually the Health and Social Care Act. And they're very qualified in terms of their accountants and in terms of their PR departments, but in terms of running medical services, a lot of them have no experience at all. And you look at the disaster of Serco in Cornwall with the out-of-hours service. Serco gave a service that endangered everyone who was living in Cornwall. They lied about it, and ultimately they withdrew from the contract. Now, personally, the thing that really irritates me about TTIP is something in the smaller part.
I think we have to stop soon because we don't really get you.
Something that irritates me personally more than anything else in TTIP is the prohibition of the contract provisions that are asked for special conditions. It's a prohibition of no regulations. So it means that you can't say, okay, we want a health service. The health service has to train doctors, and it has to train nurses, and it has to have some local knowledge and things like that. That's illegal under TTIP. And so you would end up with something where the health service is worn away, is destroyed by private greed, and eventually disintegrates. And I think we can still stop this, but we have to stop TTIP first.